Movement Lunch and Learn. Welcome to the Million Mile Movement Lunch and Learn. So this is our movement of many, right? We are always talking about movement of many, MOM, Million Mile Movement, right? This is a call that we host all the time on Fridays, right? And once a month, we host these special calls called the Lunch and Learn. And you know what? This was actually created by the chairwoman herself, Stephanie Dawn, to bring awareness as in a deep dive to all of the chronic diseases that we have. We do so many calls, but we don't explore really what certain things happen and why they happen and how we can look at preventative measures, right? And I'm sure if you're new to our Million Mile Movement, what we do is that we talk about the awareness of the toxicity in our food. Our food is there's so much toxicity in our food. You know, this is something I'm very passionate about, and that we need to start addressing it and bringing the awareness how much our food can actually hurt us or actually heal us. Okay, so yes, let's get started. I have incredible testimonials today, and I cannot wait to hear from all of them. Yeah, so let's keep the chat active. I love the questions already, so let's talk about this. So let me introduce myself a little bit. Okay, so I'm Taz Ferreira. I sit on the chair. I sit on the council with the Million Mile Movement, and my background is actually in genetics. So over 14 years ago, I used to work in allopathic medicine and research. And during this time, I became very sick. I got diagnosed with so many issues. And what I noticed is that they were not looking at anything holistic or nutrition that could help my body regenerate itself. So I had to look for myself. So I left the field completely and I started looking into phytochemistry. I'm like, you know what? This is all about Hippocrates. Hippocrates started everything off with aloe. Why shouldn't we look towards nutrition, right? So I started looking and digging deep into my own research. And surely I started regenerating my own body's natural cells. I started feeling amazing. I was not hooked and I was not dependent on medication anymore, right? And I think this is something that we all become dependent to medication. So we're going to be talking about preventative measures and ways that you can cope and, you know what, actually thrive. So I have a couple people who are going to be talking about these issues. I would love to, okay, so we are talking about diabetes, okay? So we're going to be talking about gestational diabetes, type 1 diabetes, type 1.5, type 2 diabetes, okay? And we want to show you how you can reduce your long-term risk and your complications, right? Because diabetes can have a lot of risk. So let me just give you an idea of what are some of the risks that can happen. You can develop Alzheimer's, brain fog, acid reflux, abdominal issues, bloating, fatty liver, kidney disease. I mean, the list goes on and on. And isn't that interesting? When I mention all these issues, what is something we think of? Doesn't it sound like gut health? I know whenever I hear of all these issues, it always comes back to how about gut health? Once you start changing your lifestyle, you know what can happen? You could start changing your genes. So what we've noticed, we've done so much research that over 500 genes can actually be changed within 3 months of lifestyle changes. How incredible is that, right? I don't think this is something that we look enough to. And in allopathic medicine, they don't look towards nutrition or lifestyle changes to help our bodies regenerate itself, right? Okay, so when I spoke about type 1.5 diabetes, have we ever heard this term before? Maybe a lot of you have not, right? So 1.5 diabetes, actually type 1 diabetes, only something that you'll get in the later years. So it's usually diagnosed with someone who's 30 years and above. And type 1 diabetes is usually called juvenile diabetes. Okay. And you know what? Type 1 diabetes is actually an autoimmune disease. Okay. So that's so interesting. And we're going to have an incredible testimonial about type 1 diabetes. So what it does, I'm just going to give you a little touch what all of these things are. And then we're going to have our testimonials talking about their incredible stories, about their incredible transformation. Because it doesn't matter how much of the science we speak of, it's the people. It's how it's actually affecting everyone's body that we're really interested in, right? Okay. So what happens is it destroys the islets, which means your pancreas is not producing insulin. Okay, so that's type 1. Type 2, you're not going through this, but now your pancreas is pumping out too much insulin. Okay, so these are the differences. And yes, so let's talk about this and I'll get into it. Okay, so I want to introduce to you my first testimonial, Bobby Barbaro. Okay, so he is one of the co-hosts of Mastering Diabetes. If you guys don't know him, check him out. He is incredible. I love his page. He's on Instagram. He has books. He's an incredible human. And he is a New York Times bestseller as well. And he's been dealing with this issue since you were 14, right, Bobby?
Yes, I was actually 12. So it's been over 21 years now that I've been living with type 1 diabetes. And I saw in the chat box that it was Shari who has a child with type 1. So I'm glad you're here. I saw somebody said living with type 2. So I'm glad to have you guys here so we can learn.
Absolutely. So I would love to hear your story about type 1 diabetes. Like when you got diagnosed with it, what did they tell you? And what solutions did you ever use?
Yeah. So like I said, I was diagnosed when I was 12 years old. And actually my older brother was diagnosed prior to me. So I kind of self-diagnosed myself. I said, Mom, I'm thirsty all the time. I'm going to the bathroom all the time. I think I have diabetes just like Steve. She said, no, don't be silly. You don't have diabetes. I said, okay. So enough time passed. She was out of town. She called to check in and see how things were going. It was just me and my older brother with type 1 at home. And I said, Mom, I couldn't sleep last night. I was cramping. She said, okay, go upstairs, test yourself and see what you're at. And I was well over 400. And if you're a non-diabetic, you really shouldn't exceed 140 after a meal. So that was after breakfast. And my brother said right then and there, you have type 1 diabetes and you got to pack your bag. You're going to be in the hospital for a few nights. So we went through the typical measures, got the official diagnosis. And I remember my dad coming back from the trip with my mom and saying, you know what, it's just an inconvenience. Don't worry, you can still do whatever you want in life. And that's the way my parents sort of addressed it. But at the time, they were only aware of really standard American diet and regular medical care. So I was living in Minnesota and they wanted to make sure that my brother and I both had the best medical care possible. And they took us to the Mayo Clinic. So I had an endocrinologist there. I had a nutritionist. I had a psychologist. I had a whole team. But nobody ever mentioned anything to me about reversing insulin resistance, about changing my lifestyle choices to not only improve my blood glucose control in the moment, but also my long-term health and reduce the risk of the complications. So I had to learn about that on my own. I was literally given the food pyramid. I said, they said, have a serving of fruit. My mom tried to follow their guidelines as best as she could. I literally had my fruit at dinner was a can of mandarin oranges with plenty of syrup in there. When I had strawberries, I would pour powdered sugar on top. So it was a very, very standard American approach. But over the years, I eventually learned about many different approaches. I tried many different approaches, but the information that really changed my life was a book that I'm actually not recommending, but it did change my life. It's called Kevin Trudeau's Natural Cures They Don't Want You to Know About. So some of you on this call might remember this guy. He was on infomercials everywhere. The cover of the book was purple and is sold like gangbusters. But then he went to jail for some fraud. So again, I'm not recommending the book, but it planted a seed in my mind that, you know what, maybe it's possible to reverse type 1 diabetes. So I said, you know what, I'm going to do everything I possibly can to improve my health from the inside to see if I can get my own beta cells to work again. Because like you heard earlier, type 1 diabetes. It's a condition where your beta cells have been damaged and they are no longer producing a sufficient quantity of insulin. So you have to inject insulin to stay alive with type 1 diabetes. So I go on this mission. I'm going to try and learn everything I can. And I can't say today that I've figured out the solution of how to make my own new beta cells. I'm still on that journey, but along the way, I learned a lot. And so with the information we have right now, the goal with type 1 diabetes is to inject a physiologically normal amount of insulin while following a healthy diet for your high quality of life now and your long-term disease risk. So people living with all forms of diabetes, including type 1, the number one cause of death is not high blood glucose readings, not a high A1C, it's heart disease. All right. Then we move into kidney disease. Then we have fatty liver disease impacting people with type 1. So it's the same complications that affect people with type 2. So at Mastering Diabetes, we bring people living with all forms of diabetes together to focus on one thing, and that is maximizing your insulin sensitivity. And we do that through a low-fat, plant-based whole food diet. So before I discovered that approach, I tried a Weston A. Price Foundation diet. I tried a ketogenic diet, a plant-based ketogenic diet. And the problems I had were I was low energy. I had cystic acne, which is very frustrating. I had plantar fasciitis, which was a pain in the arch of your feet, which was very frustrating as a competitive tennis player. And I would get sick every year. I used Nasonex, I used Claritin D. I would still get sick every year. It was very frustrating. But in my journey to figure out, okay, what can I do? What can I do to try and reverse type 1 diabetes? I did try a plant-based ketogenic diet. So when I switched from that approach where I was eating lots of greens, lots of celery, lots of lettuce, lots of leafy greens, I also included a lot of nuts and seeds, there was almond butter, there was olive oil. So it was a very high fat diet. When I switched from that approach to a low fat plant-based whole food diet, which we teach at Mastering Diabetes, I saw my insulin sensitivity improve by 900%. That's not a typo. That's not a mathematical error. By 900%, my glucose tolerance, my ability to take glucose out of my bloodstream into my cells with the insulin that I'm injecting improved 900%. So this personal journey led me to go and look and say, okay, wait a minute, what's in the research here? And lo and behold, we have known that reducing your fat intake and improving your whole foods from like plants can improve your insulin sensitivity. We've known this since insulin was discovered. So 1926 was one of the first papers published. It was in the New England Journal of Medicine. Dr. Sansom saw that as he included more carbohydrate-rich foods, his patients' insulin sensitivity improved, and a laundry list of other issues improved as well. And this repeated decade after decade after decade in the research. So we know this now. And so it's not just my experience, it's not just the research, but at Mastering Diabetes, we're working with thousands of people living with all types of diabetes. And because myself and my co-founder Cyrus are both living with type 1, we end up working with a lot of type 1s as well. And we see this result consistently. So people come to us, they improve their time in range, they lower their A1C, they reach their ideal body weight, they gain energy, their skin clears up, just like my skin cleared up, and their vision improves, their cardiovascular health improves. Like it's amazing how when you focus on simply reversing insulin resistance, there's a cascade of benefits, because insulin resistance is at the root of a laundry list of chronic conditions, including heart disease, fatty liver disease, cancer, high blood pressure, high cholesterol, PCOS, neuropathy, retinopathy, the list goes on. So that's what we do. We focus on insulin sensitivity. And I must say that anybody living with any form of insulin-dependent diabetes, you have this special piece of data where you get to assess your insulin sensitivity on a meal-by-meal basis. And so those of you who aren't injecting insulin, if you eat a meal, you're not sure, did your pancreas produce more or less insulin? But all of us type 1s, we count the amount of carbohydrate we're consuming so we can figure out how much insulin to inject. And we know how much, what our blood glucose levels are because we're using a CGM or we're pricking ourselves. So those three pieces of data can give us insights into what lifestyle behaviors, what foods can make insulin work more efficiently. And this is very powerful because we have over 100 million people in the US alone who are living with pre-diabetes or type 2 diabetes. And the cause of that is insulin resistance. So I saw a question come in earlier about, can we reverse type 2 diabetes? The answer is, if you catch it early enough, yes. You could become an insulin dependent type 2 if it lasts too long. And if that's the case, that's okay. Don't worry. You can still have a high quality of life and reduce your chronic disease risk. But the name of the game is to reverse insulin resistance. And we show you how to do that at Mastering Diabetes.
Wow, incredible, Robbie. So you guys are hearing it first. Carbohydrates are not the enemy, right?
That's right.
Isn't it, in allopathic medicine, you're taught that to avoid carbohydrates and to eat high fats.
That's right. So I consume well over 700 grams of total carbohydrate per day. I use a physiologically normal amount of insulin, 27 units. That's my total dose. So my long acting is 11, and then the rest is my short acting insulin. And I have an A1C of 5.4%, and I have a time in range on my Dexcom of well over 85%. So those are my numbers that they speak for themselves, but it's not just me. You can look on our website, you can look on our Instagram. This is happening with our clients across the board, reversing type 2 diabetes, improving type 1. You're exactly right. Carbohydrates are not the enemy. The cause of insulin resistance is the consumption of excess dietary fat that then gets stored in your muscle and liver tissue. And it's that excess dietary fat that inhibits insulin from functioning properly.
Exactly. Does anyone have any questions for Robbie?
Yeah, any questions, let me know in the chat box. I'll try and answer as many as I can. I do unfortunately have to leave shortly, but yes. You can also always DM us on Instagram. You can send us an email. Like, our team is happy to help. But if there's any questions you want me to answer, let me know.
Thank you so much. So Robbie, were you on any other medication? Oh, and how's your brother? Someone asked.
Yeah. So my brother, he doesn't choose to follow this lifestyle. So, but I don't really talk. I have like a rule. I don't really talk about my brother. I want to talk about my brother's health. But so anyways, you can only lead by example, and that's it. So let's see, what was the other question? So my Instagram, it's at Mastering Diabetes. That's our company Instagram. My personal one is Mindful Diabetic Robbie. But if you want to send a message and get a reply, you got to send it to Mastering Diabetes for sure. Let's see. What was the other question? I forgot the other question.
Were you on any other medication?
Oh, medications. Yeah. So the only other medications I used growing up was like allergy medication. And because of the acne that I had as a teenager, I used a lot of like antibiotics and creams, and I would go do these laser treatments and stuff like that. So those are the only pharmaceutical medications I was using. I currently still use insulin, but that's it.
Okay, so I'm curious, before you leave, once you started seeing these changes in your body and you went to your allopathic doctor, right? Because you have to go to them for the insulin, right? What did they say? What did they have to say about this?
Okay, so I actually, I've seen many different endocrinologists over the years. And for many, many years, I never brought it up. Like, I literally would just go to the doctor. They would, run their numbers, run the tests. Like you just said, I had to get my prescriptions, and that was it. Like, they never asked. I think they didn't see any problems. So they didn't ask about my nutrition. They didn't ask what I was doing. They were just like, okay, keep going. You're doing great. Any questions? Like, no, I'm good. So I didn't want to I didn't see any need to, have any confrontation or, waste my time talking to them about something where if I wasn't actually wanting their advice, like, what's the point, So the last endocrinologist I had in Santa Monica before I moved to Miami, he was a really nice guy. He was curious. He had heard of, I worked at a company called Forks Over Knives for a little bit, launched that with my good friend, Brian. So I told him about that. Then I told him when our book came out, and he was curious, but he was never really he himself was overweight and had type 2 diabetes. He was wearing a CGM, and I'm pretty sure my CGM results are better than his. But, sometimes not everybody's interested. Not everybody wants to take the next step. So all you can do is lead by example and wait for people to come to you. Like, if they were curious and oh, wow, how do you do this? What's going on? Of course, I'm happy to answer the questions, but until somebody comes to me, I don't really push things on other people.
And you know what? You are absolutely leading by example, right? And you are showing the example to so many millions of people living with type 1 diabetes that you can thrive and it can be controlled.
Absolutely. No question. You can have all your dreams come true. No question. All the technology, all the resources we have, this is the like the best time to live with type 1 if you have to live with type 1.
Wow. Thank you so much. Thank you so much. I know you have to go, so thank you so much for your time. And thank you so much for being here.
For sure. Thanks for having me. Have a great day, everybody.
Thank you, Robbie.
Bye.
Bye. Thank you. So talking about type 1 diabetes, right? We were talking about at the beginning how it's an autoimmune disease. And we, as a Million Mom movement, we have another testimonial, right? Of this incredible mom living with type 1 diabetes with her son. So she's going to come on and she's going to talk to us a little bit about that. So the floor is yours, Shari.
Hi, everybody. Thank you, Tess. It was great to see Robbie. Jordan and I actually spent some time with Mastering Diabetes this past spring, I should say. So that was really great. A lot of great information for diabetes for sure. So my name is Shari. This is my son, Jordan. He's 11 years old. I'm also a holistic nutrition and health coach. I specialize in family nutrition and autoimmune conditions. So I'm no stranger to type 1 diabetes. My mother has been type 1 since I was born. And so I watched her struggle a lot with balancing her glucose, with her weight as well was always seemed to be an issue. She didn't eat very healthy. She would often buy all of the, sugar-free, because that's what you were kind of told to do with type 1, right? Stay away from sugar. Don't have to change your diet, but stay away from sugar. So she would buy all of this sugar-free items, which of course contained all of the chemical sweeteners. She went into many lows. I remember her having she actually went into diabetic comas more than once. And we even got a call one day from a grocery store saying that, she was in line and she had gone low and didn't know where she was or what she was doing. And they had found a way to let us know. My mom would manage her lows with sugar packs. So, those like refined white sugar packs you find at coffee shops. She always kept them in her purse. They were in the car. She had some everywhere. And the minute she would feel even the tiniest bit low, she would open her packages and just take some sugar. So this is kind of how I grew up. It was my first experience with type 1 diabetes. In 2018, my son Jordan was diagnosed with type 1 diabetes. Now, I really thought that we had created the type of life for our family where we were eating optimally, and we had as a bit of a surprise our entire lifestyle. So Jordan, a little back history is that Jordan was anxious from the time he was born. He had acid reflux within his first year of life. So he was on medication for that. He was not a good sleeper at all. I think up until about 3 months ago, I could count on one hand the nights where he actually slept straight through. So he really wasn't a great sleeper. But leading up to the diagnosis, he was a fantastic athlete. So Jordan is a great hockey player. He's a great soccer player. That was always like a really good part of, right? Yeah. Of his everyday. He was really, we were in a hockey season, we were on the ice like six days a week. So it was pretty intensive, but he really enjoyed it. So some of the symptoms that we started to see in Jordan, maybe 2 to 3 weeks leading up to his diagnosis, was that he started to he was peeing frequently. He was like ravishingly hungry. He had trouble with his anxiety. Like his anxiety skyrocketed even more. It became more intense. He was falling asleep a little bit of everywhere. I pick him up from school and he'd fall asleep just on the 7-minute car ride home. He became short of breath. And we saw a real decrease, a huge decline very quickly in his endurance. So and the endurance, like the lack of endurance we were seeing on the ice, was making it that he was losing interest in his sports. He didn't want to participate in his sports either. The day before, I wound up taking him into the hospital. So I called his pediatrician because I was getting concerned. And we had booked, the soonest appointment that we could get, which was for the following Monday. So this was like the Wednesday of the week before. And we were putting Jordan to bed, and I noticed his shirt kind of went up a bit in the back. And all of a sudden I noticed, like, I could see bones that I was never able to see before. And it felt like literally overnight he had dropped in weight. So this was extremely concerning to me, as you would imagine. And by the next morning, I was taking him into the ER. So in the ER, the first thing the nurse did was test his blood sugar based on the symptoms that I had given her. And his blood sugar was 5 times the normal range for a child of his age. So within minutes, he was like being hooked up to machines, and he was brought up to the ICU, and he was in the ICU for 48 hours. And essentially what they had explained, which I knew already from my holistic background, is that, essentially the sugar was, his pancreas wasn't making enough insulin to take care of the amount of sugar that was going through his system. And so essentially the sugar was circulating throughout his blood over the course of days, maybe even weeks, right? Because sometimes this starts to happen long before you start to see the very obvious, or the more obvious symptoms that you would associate with type 1 diabetes. So, so because of this, his blood had become acidic, and it was, he was in ketoacidosis. And so it was very important that he be in the ICU. What else can we say? Pretty much said everything. So once, so the thing that was very concerning to me was that once, parents, when you're given this diagnosis for your child, you're kind of, a lot of information is thrown at you all at once. And my main question that I wanted to have an answer to is like, why was this happening? Like, how did this happen? I thought that we were doing all the right things. I'd always given Jordan a probiotic. Like I said, we ate very healthy, not always organic, but we ate healthy. I really, I gave them supplements, the best I could find, still not ideal, but I figured some are better than nothing. But the doctors didn't have any answers for me. And they actually said, like, don't concern yourself with the why. We don't know the why. And instead, just focus on what you need to know now. And what you need to know is how to, administer the insulin that Jordan is going to need for the rest of his life. And so then there was a whole bunch of training that happened. And through the trainings, we were able to learn how to administer the insulin. And we were shown what to do in case of a low. So what we were told to do in case of a low for Jordan was to give him things like candies, those rocket candies that we get for Halloween. Well, those were actually mentioned specifically, and the nutritionist at the hospital actually showed them to us and said, like, these are great, you can have them, you can have them wherever you are, keep them in your car, your purse, his school bag, and you can just pop them anytime. And I have to say, I was really surprised that we hadn't gotten further, right, in what was being suggested and recommended for us to do. Like, from the time to me, there is no difference from rocket candies to my mom, using sugar packages as a means to sort of self-medicate a low, right? And none of this resonated with me. It didn't make any sense. And so I started diving deeper, and I started looking for what we could do to help Jordan, because the idea of managing just didn't make any sense to me. And so I found some things that were helping, but they still weren't cutting it. And this is when I found Purium. And Purium was really the piece that pulled it all together, and that really took us from managing to thriving. We've only been on Purium for 3 months now, but Jordan takes the Power Shake with barley juice powder and the Green Spectrum every morning. So he drinks that before he even has his breakfast. Then with his breakfast, he has an Epigenius Kids Shake. And then we have a Apothecary in the evening. So those are the main Puriums that Purium superfoods that Jordan takes. And the difference in just 3 months has been nothing short of amazing. Like his endurance is better than ever before. He's sleeping through the night every night. And I can't stress that enough, like every single night. And his blood glucose levels are beautifully balanced.
Wow. Okay. So you know how we were talking about with Robbie about carbohydrates, and carbohydrates are not the enemy. So it's simple carbohydrates that we need to look at. And in the Epigenius kids, it's full of complex carbohydrates.
Yes, exactly. And it's just been the perfect balance. I feel like he's really getting everything that, between what Mastering Diabetes, what Robbie was saying, and what I've learned myself and what I've come to understand even about gut health and just how it all comes together. I mean, that's why Purium has really put it all together and really sent us into that thriving stage.
Shari, can you talk a little bit about the barley grass juice that you incorporated? Because I know it's helped a lot with the blood glucose level.
It absolutely has. And, there's a reason for that. So barley juice is in research linked to balanced glucose levels. And so he could, sometimes Jordan will just have it in the morning and we see the results for the rest of the day. And sometimes if he has something that's maybe a little bit higher, that can sometimes maybe shoot him up a bit higher, then he can always have another glass of it before, so let's say we're celebrating a birthday or something like that, and we know he's going to be having something that's maybe off of the norms for what we would eat. Then, he just has a little glass of barley juice powder, and that helps him. There's no spiking when he has the barley juice first.
Wow. Okay, Jordan, can I ask you a question?
Yeah.
Okay, so how have you felt in the past 3 months, before and now?
Well, I definitely do feel better. I feel more active. I have better endurance. I'm sleeping better. So I have been feeling really good.
How about your anxiety levels? How are those?
I'm still anxious, but they weren't as bad as they used to be.
And how do you love the Epigenius kids?
It's really good.
Is this something that you talk to your friends about? How do you deal with your friends when they know you have type 1 diabetes?
Well, little of them know, because most of them don't understand, but they don't. I'll explain to them how it is, and then they'll ask me some questions about it, and then I'll answer them. Because not many of my friends know about diabetes.
Well, you know what? Not a lot of adults know about it either. So that's something that whenever you hear someone's diagnosed with diabetes, they always think that, oh, it's your sugar. You have to cut your sugars in your life. They don't even understand the connectiveness and why this is actually happening. Okay, so stay close, Shari and Jordan. I'm going to come back to you. But now I want to introduce another incredible testimonial, another type 1 diabetic who will share her story and her journey with Purium. So Aisha, the floor is yours.
Thank you so much. Hopefully everyone can hear me loud and clear.
Perfect.
Okay, awesome. I was diagnosed with type 1 diabetes November 26, 2014. I was, I think, around the age of 20, around my 20th birthday. Basically, I was a vegetarian at that time. I ate a lot of dairy. Like, I was obsessed with dairy. I don't think I really cared that much about my health. I do have a genetic link in my family. My late uncle had type 1 diabetes as well. He actually passed away when he was 19. My cultural background is Pakistani, so he was in Pakistan when that happened. It's the only other person in my family that has it, and now I have it. So I want to talk about my journey with health and how I actually went vegan after I got diagnosed with type 1 diabetes. I started to do a crazy amount of research when I was diagnosed. I remember sitting in the hospital and them telling me that I have type 1 diabetes. And I was like, what is type 1 diabetes? I don't even know what that is. I didn't know it existed. I knew nothing about it. I started to research like crazy. I learned that there is a link between A1 beta casein, which is a protein found in milk, which could be a potential trigger for type 1 diabetes. And that kind of rang a bell in my head because I was eating cheese, milk, ice cream all the time. Honestly, I'd go to the fridge, I'd open it, and when I'm looking for food in my fridge, I'd snack on cheese. I was absolutely addicted to cheese. So that's what I gave up. Completely gave up cheese. I've been vegan now for 7 years. So about the same time that I was diagnosed. I went vegan a couple months after. What else? I'm a little nervous. Sorry, guys. Okay.
You're doing amazing.
Yeah, thank you. Okay. So I think Tass approached me, I believe, a few years after I was diagnosed, 2017, around there. And she was introducing me to Purium. She's like, have you tried the Power Shake? I was like, no, what is that? And then she got me hooked on the Power Shake, on Biomedic. And then she suggested that I do a parasite cleanse. And this was when so much changed for me. I didn't think it was going to do anything. I felt like I was one of those deniers. I'm like, yeah, I don't think I'm going to do anything. I took it. I took the whole, I think it was 30 days at that time. So it was 40 days.
40 days, yeah.
Yeah, it was 40 days at that time. The parasite cleanse. And I actually reduced my long-acting insulin intake by 6 units, which was huge. Huge for me. I've never done that, ever. And it's actually been the same since then. And this was 2 years ago that I did the parasite cleanse. A little unrelated to diabetes, but still with my health. I used to have like a twitch in my eye that completely went away after I did the parasite cleanse, something I didn't even think about. But then my friend pointed out to me, she's like, your eye isn't twitching anymore. I was like, what do you mean? Yeah, it was right after the parasite cleanse. Absolutely amazing.
Isn't that incredible how it lasted that long? It was 2 years ago since you did your parasite cleanse.
I feel like a completely changed person since then, completely. I'm due for another one. I gotta do another one. I was also told, going to like my doctor's appointments and meeting with my diabetes educators that like I need to really restrict my carbohydrate intake because that's what would spike my blood sugar. Yeah. But it turns out I now eat like 300 grams of carbs a day. I'm not on Robbie's level or I'm at like 700 grams a day, but yeah, 300 grams of like whole food, plant-based carbs. My A1C is 6.7. It has never been over 7% other than when I was diagnosed. I have not been back in diabetic ketoacidosis at all. The only time I was in that was when I was diagnosed. Pretty much everything changed when I went vegan and when I started to use Purium products completely.
It's almost like a lifesaver that you got diagnosed because it brought this attention, this awareness of nutrition into your life.
It completely changed my life. I don't think I'd care that much about health now if I wasn't diagnosed with type 1 diabetes, to be honest. Maybe I wouldn't be vegan. Who knows? But yeah, it really did change a lot for me. I remember being scared to take apothecary because it's a very concentrated form of cherries. I'm like, oh my God, there's a lot of sugar in it. But I learned that there's a huge difference between, the naturally occurring sugars in our food and then refined sugars and chocolate bars and all that other stuff. I take apothecary before I go to bed, just like Jordan. And it doesn't spike me at all. Not at all. My levels are so good when I take apothecary. And another thing I started taking a lot more was superxanthin for eye health. We constantly hear about diabetics and how their eyesight, they can go blind, from uncontrolled blood sugars. I started taking superxanthin. It's amazing. It's amazing for my eyes. I'm also a professional photographer. So having my eyes, really important. I'm not sure what else to say. Okay. Oh, thanks. Thank you, Stephanie. I wouldn't be being anything in autoimmune disease. Yeah, definitely, Kevin, definitely. Awesome share. Thank you. I think we lost Tass.
Oh my gosh. Wow.
I guess I can answer some questions for now.
Your story is amazing, Aisha.
Thank you.
Yeah.
Thank you so much.
Yeah, it was 2 years ago that you found these protocols.
Yes, 2 years ago that I found Purium.
Mm-hmm.
I was introduced to Purium. Yeah.
Wow. Yeah, thank you so much for sharing your story. It's in the sharing of our stories. So many of us don't understand the power of nutrition to help turn our health around. We think it's got to be a pill or it's got to be, a very expensive treatment of some sort. And really, it's pennies on the dollar, really, to be putting whole food, organic, potent nutrition into our bodies on the daily. That's really, it's very basic.
I was told, no matter what I would do, my levels are going to be crazy. I'm just going to have to deal with it. But that is not the case at all.
Right.
At all. Yeah. Whatever you eat, whatever you put into your body will help you manage your diabetes better. It's a fact.
Yeah, yep. Brilliant. Thank you for specifically naming the products that helped you. I think that's really helpful for people who are here now and those that are going to be watching the replay.
Oh, for sure.
Do we have Taz back yet? No?
I don't see that she came back.
Oh my gosh.
Oh no.
Well, I think I'm gonna pivot to her next guest because I do know this person very well. And I want to thank you for being with us, Aisha. Keep sharing your story, my dear. Well,
thank you so much.
Yeah, thank you. So our next guest is a dear friend of mine. I've known her now for approximately 4 years, and I've got to watch her health transformation. And it's been profound for me to watch her really take her health to a whole new level as a result of tuning into her nutrition and really taking, what we have here, the Purium protocols, very seriously. So, Miss Tal Kapoor, are you there? Can we unmute Tal? I'm not seeing Tal. Don't tell me we've lost Tal as well. What's happening with our, there she is. There she is. We just need you to unmute. If you could unmute Tal Kapoor. Danielle. Here we go.
Okay, there I am.
You finally, that took a moment.
That's okay. That's okay. Thank you so much for such a beautiful intro, Stephanie. It's been such a treat for me to be supported by you on a daily basis, as well as your amazing team and this community. So yeah, you've been there from the very beginning and seen the before, the during, and now. And it's really been quite an experience for me, something that I really was not expecting. So I was diagnosed with type 2 diabetes when in January of 2017. And but I'm going to reverse my story back a little bit further because my first diagnosis with diabetes was with my first child. I had suffered for 30 years plus with PCOS. And so getting pregnant in the beginning was very, very difficult. And we went through all kinds of procedures and so forth. And we managed to be pregnant. And immediately, I'll just skip the whole long story of that pregnancy. But around, I would say around 5 months in, I was diagnosed with gestational diabetes. And, immediately my doctor sent me off to the nutrition, the diabetic nutrition. And I was now high risk and all of this was going on. A lot of things were being thrown at me. And I had years of experience of being a doctor's patient. And so I trusted in the system and followed along with what was being told. I did everything I needed to do, especially now that I'm growing another human in my body. I need to be able to be on top of it, right? So whatever you guys tell me to do, I'm going to do it verbatim. I'm not going to question because you're the professionals and you know more than I do. And that's great. Okay. Carried him to full term, had a very difficult delivery, but then he was born. Sweet little angel. Now he's 19 almost. And my diabetes went away right away on the operating table. So I had a C-section and that's it. I was no longer diabetic. Woohoo! But my doctor did warn me that it was inevitable, that once I get into my 40s, that I was going to be inevitably a full-blown diabetic. And I was, whatever. I was 30 years old. I had time, whatever. There was no guidance really on what to do or how to avoid or how to prepare or, maybe take care of yourself. The only thing I was ever told was, if you lost 20 pounds, I'm sure that would set it back. Like you'd save yourself another 5 or 10 years if you lost 20 pounds. I was 100 pounds overweight. So really 20 pounds, really? Okay. And so I fluctuated a lot. And then we got pregnant again with her daughter. And that pregnancy was a little bit different. I knew right away that I was pregnant because my blood sugars went up. With my son, because I had PCOS, I did not know that I was pregnant until I was 22 weeks pregnant. So it does happen. And with my daughter, my body knew what to expect. And immediately I started feeling the dizziness. I started feeling the weird sort of out of body experiences. And so I went and pricked my finger and my sugar levels were high. All of a sudden I was at 376, the first test that I took right after breakfast. And I was like, oh, okay, that's high. All right. Wow, I'm pregnant. Oh my gosh. Like before the test told me, I knew it. So, and with that pregnancy, I was on bed rest for the last 4 months of my pregnancy. I was not a very good incubator for her, is what my doctor told me. Those were his words. And I was like, okay, that's fine, because I got other things going on in my body, but can we keep her in here for as long as possible, please? You know? So I was assigned bed rest, and we were able to bring her 4 weeks before her due date. And she was born beautifully, screaming, hollering, strong lungs and everything. And then I had a diabetic shock. I had a diabetic episode that in the recovery room took a long time. I kept telling and shaking there on the bed. And I kept telling the nurse, something's wrong, something's wrong, something's wrong. And she was like, no, you're just really cold. Because I tend to be cold a lot, very easily. And so she just kept dumping blankets on top. And I'm like, no, something's going on. It took like an hour before we finally got the doctor on the phone, and he prescribed me apple juice. He said, just give her some apple juice. She needs sugar right away. So gave the apple juice, and I started to normalize. My shaking was like, okay, all right, great. And then I had apple juice prescribed to me, as well as some other sugary things during my meals while I was recovering from my C-section in the hospital. And that was to keep me normalized. Okay. Whatever, right? You do what you got to do, right? My PCOS still continued after that. And then I was fine, right? Other than other ailments happening. When I turned 43 in 2017, I went in for my regular checkup, and there's always okay, we need to up your meds for your blood pressure, your cholesterol, your this, everything just needs to climb. Oh, and by the way, now your sugar levels are really too high, and we need to get you back on metformin right away, because you're now officially type 2, and you should have been in here 6 months ago, so we could have started you on this right away. Like, you're in urgent situation right now. We need to get this under control ASAP. I was like, wow, okay. Oh, and by the way, because of all the medications you're taking, Tal, and the duration that you've been taking them, you're looking at dialysis in another 10 years, daily dialysis in another 10 years. So that was a real shock to my system. And I did not know what he was talking about. I was like, what? Wait a minute. No, I'm only 43 and I've got 2 young kids. And like, I can't, what are you talking about? You're telling me that I'm at the end of my lifespan? Like, that doesn't work for me. Like, that's just not okay. And then I was introduced to Purium. And much like the speaker before, I'm sorry, I can't remember your name, but you're so beautiful with your hair and your eyes. I love it. The first parasite cleanse did the trick. It just did the trick. I did the first 40 days at the time. Also, it was 40 days for me as well. And then I kept doing it. And then after 90 days, I had realized I had lost 31 pounds. And I thought, started feeling a little weird, strange, kind of knew that something was off. And immediately it came to my mind that I may have been over-medicating myself. And so I don't recommend it, but I did it because I took charge of myself and figured that I wasn't going to take my meds anymore. I was just going to stop for a couple of weeks and see how I felt, because I know that I'm now flooding myself with all these super nutrients, and I was being plant-based vegan for the most part. And so, yeah, I did that, and I haven't taken medication since. And all my blood levels are perfectly normal, and I'm feeling amazing, and I'm free of PCOS, and I'm free of type 2 diabetes, and I'm free of constant migraines. And, you know, my eyesight has also improved thanks to the super xanthan as well. And I can't even explain to you, as a woman suffering with PCOS for so many years, and battling the ups and downs of understanding sugars and how to control carbs and all this stuff, what it really feels like to be a real woman inside this body that I was constantly for years being told it was failing, that it was not living up to what my dreams were, and that this vessel wasn't going to last. And that was detriment. And now I'm just like, are you kidding me? This is a rocking body. Okay. This is a rocking body that's got some serious power. And you know why? Because I put myself in that power, right? Let's freaking go, Grace, right? Like, I have control way better than anybody else. And yes, I do still take on advice from doctors and Western and Eastern medicines and all this kind of stuff. I'm hearing all of this stuff, but I know what I need, and I know what's worked so well for me. And I'm able to now support so many other people that suffer the way that I have suffered. And I just, you know, I mean, there's something, Stephanie, that you always teach me. You always say your body is not your enemy. It's not out to get you. And it's so true. It's just not. It's just not. So
Tal, I love your story. I'm back. I'm so sorry. I crashed the internet. So sorry about that. Your story is so incredible. And you took your power back, right? With your health and your nutrition. You know what? I want to go back though to when you were diagnosed with gestational diabetes, right? As soon as you gave birth, what happened?
Yeah. So I was telling that with my second delivery, I was on the recovery table for like an hour, shaking profusely, just like rattling. My head was rattling. Everything in my whole body was just shaking constantly. And I was like, oh my gosh, you know, and the nurse thought I was cold and kept throwing blankets on me. They put me closer into a different side of the room to be closer to the heater. And I was like, it's not cold. This is not right.
So I'm talking about the first time you were diagnosed with gestational diabetes. And after you delivered, they told you it's all cleared. And you don't have to change the way you eat.
Yeah, you're all clear. You're good to go. Yeah, thanks so much.
Go.
Enjoy your baby. Yeah, that's
exactly.
Wonderful. Yeah,
exactly.
Yeah.
And the nutritionist told you to have cheese.
Yes, thank you for reminding me this. I'm glad we talked before, because this is really important, guys. The nutrition counseling that I got from I was at the time a person who knew nothing about nutrition. Okay, and so I put my faith and my trust in the people who had been to school for this. They were the professionals. Okay. And what I was told unequivocally was, again, if you have a low, you're going to need sugar. So carry those Splenda packets, which are really great. Carry those Splenda packets in your purse, keep it in your car, keep it next to your bedside, keep it wherever you need to be. Right. And anytime you're feeling that low or you're testing low, tear it open and open and have it. Either that, or you can do the sugar candy things. And I just didn't want to do the candy for my teeth. I thought I would save my teeth. It's nothing else. And and then, you know, yogurt, string cheese, you know, these are beautiful things to have a snack, you know, do it. My husband used to do the cheese boards for me, especially when I was on bed rest with my daughter. He would bring in my cheese boards with my insulin, you know, on top of the tray. And, you know, I'd have to, you know, I was on 336 units of insulin prior to every meal, leading up to about 2 to 3 weeks before her delivery. So it was, you know, it was really high intense. And this is the diet that they were telling me, you know.
I remember you were telling me you were the ultimate. I remember you were telling me you were the ultimate doctor's patient.
Oh, absolutely. I was their best friend. I was their favorite. I was there not only because I'm wonderful, but I'm kidding, but because I did everything they told me, and I never questioned. I trusted them. We had great relationships, and they're wonderful people, wonderful human beings, and God bless them. They are just doing what they've been taught, right? They're preaching how they've been trained and how they've been taught. And so, you know, science is interpretive sometimes, right? Science is real, right? But sometimes you can take that and you can go this direction or you can go that direction, and not everything works for everyone. But I'm telling you, plant-based does.
So that's my cue, okay? Science actually does work, but it's reading the accurate science, right? And linking everything to the root cause issues. When you were talking to me about gestational diabetes, I'm like, that for me was a clear indication that you need to start listening to your body. Okay, do you guys understand how important the microbiome is to diabetes? It's so important. This makes everything. It makes your serotonin levels, your cortisol levels, your melatonin level, everything is interconnected. So if you're going through gestational diabetes, this is a sign that something's happening, because what we eat, this directly goes through the umbilical cord. So we are making our baby's microbiome, right? So that means that we are making what happens to them. Type 1 diabetes, type 2 diabetes. So let me give you some indications how you can actually alter type 1 diabetes, right? This is how it starts. If you have a cesarean, is a huge indication, because vaginal delivery actually gives your baby the healthiest microbiome, okay? Breastfeeding your child, that's another one. And not pumping your baby with loss of antibiotics. So these are 3 key signs to protect your baby from type 1 diabetes, okay? There's something else I want to talk about, because I know all of your stories. You guys were all athletes, okay? When you were teenagers, you were athletes. So let's do the interconnectedness here, okay? When you were an athlete, you produce a high amount of cortisone, right? Which when you have a high amount of cortisone, you have a high amount of serotonin levels. So this is protecting your body from actually spiking, from going into your diabetes, from the diabetes to actually be materialized. So once you stop being an athlete, because I know all of you stop being an athlete, you start having a more sedentary lifestyle. And it took 2 to 3 years, then the diabetes started appearing. So I found that very interesting. Now your cortisol levels lowered, your serotonin levels lowered. So now your microbiome is kind of not protected, right? And what happens with nutrition is that you constantly have to live this lifestyle, right? It's not you adopted once and then you revert back to unhealthy eating. This is a lifestyle. This is why we stress this. This is habits that you are retraining yourself on a cellular level, right? So it's just very interesting how all of this is actually connected and how these lifestyle habits changes everything in your body. So pay attention, you know, like Sherry's son, I know an outlet for his diabetes was hockey, right? And the hockey actually helped him cope. And here's another thing I wanted to make interconnected for all of you. Metformin, because I remember you were telling me that they had prescribed metformin to you. You know what metformin does? It actually lowers your serotonin levels and produces more insulin. So it does the opposite of what your body needs to do. So isn't that interesting? And I love how you guys all connected how nutrition can actually change your body on a cellular level, because this is what it does. And look at all of you thriving today. And not only thriving, you're sharing this forward. You're telling everyone about this, because if it can help you, you know what? It may help someone else. So we are at our hour mark. So thank you all so much for being here. Thank you for sharing your incredible stories. These are life-changing stories. And you know, we could get into the science of this, but nothing brings more value than hearing lives change, family lives change when we hear these testimonials. I appreciate all of you. Thank you all for being here. So reach out to the person who invited you on this call, and they have a solution for you. They have a gift card for you. Reach out to them and they will get you on this incredible, incredible journey. Thank you so much, everyone. Have a beautiful, beautiful day. Thank you.